I think it's fair to say that almost 2 years since our first cases of the coronavirus in New South Wales, most people would be familiar with the concept of the major concern that we've always had is whether or not our health system would be able to cope with the increased number of patients coming into our hospitals and coming into our intensive care units. The New South Wales government has done a lot of work to make sure that our ICUs are very capable, our intensive care units are very capable, our hospitals are very capable. Well, I want to thank, as Health Minister, I want to thank all the health staff who continue, despite the load that they've borne for 2 years, they continue to look after us, and they will continue to look after us. Our hospital system is well equipped to look after what may come. But I would like to also stress that we are facing the reality of a reproductive rate of this virus at being more than 1.5. Now, most of the community would know from many conversations we've had with them that we try to keep the reproduction rate below 1 because that generally means a declining number of cases of the coronavirus, whether it be Delta, whether it be Omicron. What we are seeing now is a very substantial increase in the coronavirus, the current variant, Omicron and Delta. And we're seeing every 2 to 3 days, currently, we're seeing a big increase, in fact, a doubling. Every 2 to 3 days, we're seeing a doubling of the number of people who are actually getting the virus. We, therefore, are on alert and cautious. I think the community needs to be aware of that, but also to understand that we're trying to make sure that we normalise as far as is possible in a one in 100 year pandemic the way we live our lives. And our government is going to strike and continue to strike that balance. But at the end of the day, prior to COVID, we all took individual responsibilities for ourselves and for our health. And now is the time for each of us to realise that is what we must do if we want normality. So, my strong advice to the community is, as we see these numbers increasing, and I remind the community it was only last Monday fortnight that we had 180 COVID cases. Today we have 1,360 cases. Now that tells us each of us have a responsibility to look after ourselves, our family, our friends. The one thing that we know about this, well, the one thing that it would appear to be likely with the Omicron variant is that the vaccines are not stopping transmission. The transmission appears to be quite high. We've seen that happening in Newcastle out of one rather crowded party at a nightclub, and it may well be spreading across New South Wales as we stand here talking about it, all these young people who've no doubt out and about. But what we do know is that it would appear on the early evidence here in New South Wales and certainly from South Africa and the United Kingdom, it would appear that the severity of illness is not as bad as it was with previous variants of the coronavirus. Now that's a really, really important message that every single one of us should understand. So for those who have had the 2 shots, the first 2 jabs, my strong message is if you're eligible for the booster, go and get it as soon as possible, because it may not stop you getting the virus, but it will stop you ending up getting very ill on our early evidence, and that is crucial. I would also say that each and every one of us have a responsibility to get that message across to all of our friends. We know that there are a small percentage, around about 5% in our state, who have chosen largely to not get vaccinated. My message to all of those people is have a rethink, please have a rethink, because getting vaccinated may well save your life, and it may save your family's life. If you don't care about yourself, if you bring the virus home to your aunt, your uncle, your children, your grandparents, you may be the person responsible for seeing that person get quite ill. So please go and get vaccinated. There are people with immunodeficiencies, people who don't recognise the particular frailties that they have, and they may be in your family, and you may be responsible for your inactivity in vaccination may lead to their very serious illness and possibly even death. I'd also add this, back to normality is great, but gee whiz, we've got Christmas coming up. if you don't need right now to be in a jammed-in, packed-in environment with no windows and nothing happening except music thumping, well, maybe it's not a good time if you want to have a Christmas day. My strong suggestion there would be go quietly amid the noise and the haste and just take a little bit of a time out and enjoy Christmas with less people on, perhaps on Christmas Day, and preferably outside, but certainly with the windows open. Just be cautious. If you are caught in an environment where you're inside and there are a lot of people, and obviously at the moment Christmas shopping, I tried to do some last weekend, it's pretty busy. So wear a mask. As of today, it may not be legally required, but for you and for many, it would be very sensible to actually wear a mask. Just, again, personal responsibility. And as we move forward, I should also just say this. On the simple maths of 1.5 or thereabouts of the reproductive rate, it is concerning that the simple maths has been looked at by the epidemiology public health unit at the University of New South Wales, and what they're telling us is that by the end of January we could be looking at 25,000 cases of the virus every single day. So that takes us, on my maths, to about 175,000 in a week. That's one big difference from 1,360 today, which already is a cause for concern. So as we go forward, if that is the maths, and it's a lot of work to do on that maths, and the inputs to those sort of mathematical equations, the algorithms that apply it are always difficult. A lot of the work that goes into that algorithm has been done from the UK and from South Africa, which aren't exactly analogous. We know that. And I'd remind everybody that I think it was in our first year, we had similar modelling that I've talked about publicly that told us we'd have 25,000 deaths in the first year. But because the community came out and responded, because they actually wore masks, because we all kept the 1.5 metre social distance, because we actually did all that we were asked to do by public health, we managed to keep those deaths down considerably. So nowhere near 25,000. So we may not get to 25,000 new cases every day, but we could. And so precautionary principle to me as the Health Minister, and my advice to the community is do all the things that you know keep us safe. Stay outside if you can, wear those masks, get tested if you've got any viral symptoms at all, and just be careful about yourself but also the community. Thank you.